Good morning, everyone. My name is Jacklyn Ekkert, and thank you for this opportunity to present on some of the work that I was able to do through my practicum. My presentation is on some work I did looking at readiness for implementing decolonization change among settler organizations. So I'd like to acknowledge that my practicum experience took place on the traditional territory of the Coast Salish people, specifically the Snanawas and Snuneymuxw First Nations, where I gratefully live, learn, and raise my family, and from where I'm presenting today. So just to give you a brief overview, I'll start by discussing some of the background work that was required from a personal standpoint. Then I'll provide some definition and context for this project. I'll define the purpose of my project and a bit of the process and theory that guided me, and then talk about some recommendations and implications for public health. All right, so as I was beginning to plan for this project and discuss my ideas with peers and mentors, the need to do some personal reflexive work around social location and social identity was very apparent. Entering into this work as a person who has majority settler ancestry and having experienced white privilege made it really critical for me to examine any biases and attitudes that I held. It also really made me dig into what it means to be an ally, which I learned is not a designation I can really give myself, but rather is given by those that I seek to leverage my privilege and resources alongside to bring about justice. This quote from Senator Murray Sinclair really affirmed and encouraged me through the process, and just really helped me to keep going on my journey. You have to believe that doing something about this history is the right thing to do, and you have to be fearless in doing what you can. And of course, that history is the history of colonization in Canada. So when I talk about implementing decolonizing change in settler organizations, it's important to provide kind of a frame of reference for what I mean by that. So just to highlight a few key points here, decolonization or decolonizing change is an embodied process. It's not a destination that can be reached. It's continual, it's evolving. It involves acknowledging and deconstructing imbalances of power and privilege. And it means working in solidarity, supporting and partnering with Indigenous initiatives. So to provide some context and background, Island Health has community partners that support initiatives that have upstream collective impact on determinants of health. For example, you've probably heard of community health networks, as well as Island Health has food security hubs. And these partner organizations address these complex issues and inequities affecting the health and well-being of a specific geographical region within the health authority. So Island Health is committed to reducing inequities affecting the health and well-being of Indigenous populations. And one way they're seeking to do this is by supporting their non-Indigenous led organizations or settler organizations in their journey towards implementing some decolonizing change. So Island Health identified a need to track this journey in order to remain accountable to their commitment and to provide some educational and resource kind of support as well. There are challenges due to the iterative, continual, and relationally based nature of decolonization. It is a difficult thing to measure or track. It's really more of a continual process, as I said. And so the purpose of my work was kind of to try and find an appropriate way through this. I wasn't able to find a lot in research or gray literature that was appropriate as far as an existing tool, but I did find that change theory and particularly readiness for change worked quite well because it had the potential to provide the organization a way to identify specific areas where they felt they were ready to take next steps, and also to identify areas of unreadiness that required support. And in addition, it provided that educational component. And then readiness for change is also considered to be the most, or one of a very reliable and critical indicator for a successful change implementation. So there were a number of change models. Most of them were individual level, and I really felt that an organizational level was required for decolonizing change because the change really needs to occur throughout the whole culture and the policies of the entire organization. And there was only one readiness for change theory, which was developed by Weiner in 2009 and later adapted into the organizational readiness for implementing change tool. So in addition to taking an organizational approach, it was really important for me to make intentional efforts to decolonize my approach to this. And so I was guided by the Mi'kmaq principle of Etuaptmunk, or two-eyed seeing, which wisdom keeper Albert Marshall explains is joining of an Indigenous lens and a Western lens to create something new that benefits all. So I was able to do this by overlapping the Western change theory from Weiner, and then with a First Nations experiential learning model to create a model of organizational becoming. So here is my two-eyed perspective of organizational becoming model that I adapted by overlapping the two theories. And you can see how the two models kind of complement each other to create an enriched understanding of the ongoing process of a change like decolonization. And I really think this definition of becoming captures some of the essence of the change involved in decolonization. So becoming is an ongoing process of reweaving the actors' webs of belief and habits of action to accommodate new experiences obtained through interaction. So with this foundational theory in mind, I was able to develop a two-part tool for Island Health to use with their non-Indigenous or settler community partners. The first part involved having the organization locate where they were currently on in their journey towards decolonization. And don't be overwhelmed. This is a lot of words. It's more just to give you an idea of what the matrix looked like. So I don't have time to walk you through the whole process, but roughly this matrix is meant to help organizations consider different areas of decolonization. So across the top, you can see land, self-determination, relationship, cultural safety, cultural regeneration, and to locate roughly where they are. So going from the first phase of minimal progress, truth and learning, taking action, to beginning to see some positive outcomes. So throughout it kind of provides examples. And it's important to note that the purpose of this matrix is to be an example, and it would be required to be locally developed or adapted to with the local Indigenous owners. So for part two, it involved taking the results of the matrix in part one and using it to assess for readiness for next steps on the organization's decolonization journey. So I adapted this survey from the ORIC tool that I mentioned, which has been tested, and it breaks it down into change efficacy, or the shared belief in their collective capability to implement change, and change commitment, or the organizational members' shared resolve to implement a change. And based on the results from the part one matrix, the organizations can identify their readiness to take next best steps and identify specific areas of unreadiness that may need support. So just to highlight some implications for public health, the goal of having a tool like this available for use by Island Health is obviously, for their community partners, is obviously to improve that decolonization effort and improve the health and well-being of Indigenous populations. But I think it's really important to point out that the intentional efforts towards decolonizing our non-Indigenous organizations benefits the entire population. First, when equity increases for one part of our population to improve their health and well-being, the outcomes, it improves the health and well-being of the entire population. And as I hope this project demonstrates, when we all stand to benefit from increased and enriched understanding when a two-eyed perspective is used. So I just want to thank everybody, especially Annalisa Blake, my supervisor at Island Health, my partners through SNUNAMO mentors, and other friends at City of Nanaimo. Thank you, Dr. Livingston and Natalie Franson, and all my peers and my family. And my girls made this lovely artwork on our driveway last month. So thank you, everyone. And I can take some questions now.
Thank you so much. I do like that artwork. Lovely. So, so there's a question from Meg.
Hi, Jacklyn.
Hi, Meg.
Hi. I remember you posting on one of the groups about the development of your survey. And I don't know if you ever posted, but what were some of the questions that were used?
Yeah, so there was so there's two parts to the survey: the change efficacy, which is the shared belief in the collective capability. So some of those questions would be like, are they confident they can keep track of their process, or people who are part of the organization feel confident that the organization can get people invested in implementing decolonizing change. And then for change commitment, or the shared resolve to implement the change. So an example of a question would be, people who are part of the organization want to implement decolonization, or are determined to implement, or are motivated. So based on the answers from those questions, then organizations come back and say, okay, we are strong on this, or we need to support before we try and move forward.
Okay, thank you.
Thanks, Meg. Thanks for your editing skills.
One more question from Jessica.
Hi, Jacklyn. Awesome presentation. I was just wondering, the tool sounds really interesting. Do you know if it'll be available for the public to view and perhaps used by organizations outside of Island Health?
That would be amazing. It's really in a draft phase right now, and because of the current circumstances, we weren't able to really try it out with the group. But yeah, so as far as I know, but I hope that it will be used, and that it would be made available, because I think it could be adapted for a lot of areas.